Pleural effusion. In this session, we are going to learn how we can identify pleural effusion on chest X-rays. The key findings that are present in pleural effusion include 1. Blunting of costophrenic angle, 2. Blunting of cardiophrenic angle, 3. A dependent opacity with a lateral upward sloping with a meniscus shaped contour, 4. Contralateral shift of trachea and mediastinum. Now let us move on to the X-rays. This is the first X-ray. I want you to focus on the lower zones of both X-rays. So here you have the right costophrenic angle and here you have the left costophrenic angle. So you can know that the left costophrenic angle is quite sharp. In contrast, the right costophrenic angle is blunted. So it's pretty rounded and blunted. So this blunting indicates minimal pleural effusion. I want everyone to focus on this sort of finding, this sort of blunting. This is very important and you should never miss it. In every X-rays that you see, you have to look for the costophrenic angle blunting. Now we have the second X-ray. Now again focus on the lower zone. So this is the right side, right costophrenic angle, quite sharp, and then you have this cardiophrenic angle, that is the junction between the epicardium and pericardium and also the diaphragm, cardiophrenic angle. And now focus on the left side. You can see that this costophrenic angle is missing and the cardiophrenic angle is also obliterated, and then you have a dependent opacity which is hazy. So this suggests mild to moderate pleural effusion. We have a little more fluid compared to the last X-ray. You can also note the subtle shift of the trachea to the opposite side. So here again, so this is the right costophrenic angle, right cardiophrenic angle, both of them are missing, and then you have a dependent opacity. This is a dependent opacity. This happens only in erect films. So, and you can see that interface between the lung which is floating up and the fluid down here. So there is a lateral upward sloping. So in the lateral part, the slope is on the higher side, and here it's kind of lower. So this is the lateral upward sloping, and there is a meniscus like contour between this lung and the fluid. So this is the lateral upward sloping dependent opacity. So this indicates moderate pleural effusion. You may also note the shift of trachea to the opposite side. So this is where the trachea is, right? So trachea is shifted to the opposite side. Now in this X-ray we have a complete whiteout of a hemithorax. So complete whiteout of the left hemithorax. Along with that, you may note that this trachea is shifted here. So this is the trachea. So this trachea, so it shifted to the opposite side. And then again you have this mediastinum, which is represented by the cardiac shadow, is also shifted to the opposite or the contralateral side. So anytime you see a complete whiteout of a hemithorax along with shift of trachea and mediastinum to the opposite side, the first differential diagnosis is a massive pleural effusion. So in this case also we have a massive pleural effusion. Again, here you can very well see the complete whiteout. So this is a complete whiteout of the right hemithorax, and then you have the shift of trachea. Trachea is up here somewhere. So it's here, shift of trachea and shift of the mediastinum. So complete whiteout with shift of trachea and the mediastinum indicates massive effusion. Here, focus on the lower zone. So here there is a blunting, right? So here there is a blunting, and here is also a blunted. The CP angle is blunted. So this is a bilateral pleural effusion. You can see a mass lesion up here. It's a mass lesion, hilar mass lesion. But for this particular session, I think we can ignore this thing. But you can see that here there is blunting, here there is blunting. The main point is it is a bilateral effusion. So far we have seen unilateral effusion, and this is a bilateral effusion. Again, you see this fluid here. This is a pleural fluid, and the lung is partially collapsed. And here again, you have fluid up here, and lung is again partially collapsed. Right, this is the lung. It's lung. So again, this is a bilateral pleural effusion and bit moderate pleural effusion compared to the previous X-ray. So here again, this is a patient. Basically, the point here is that when you lie down, you can have a diffuse haziness in the hemithorax. This patient has a right-sided pleural effusion. There's a mass lesion up here. There is a right-sided pleural effusion. Here there is a blunting, but this diffuse haziness indicates that maybe this X-ray is taken in a supine position. So when the patient is erect, the dependent opacity, because of gravity, the fluid tends to accumulate in the lower areas. But when patient is supine, lying on a bed, sometimes patients are seriously ill and they have to lie down, and you will be taking a supine film. The fluid tends to accumulate in the posterior aspect through and through, and this appears as a diffuse haziness. So finally, we saw minimal pleural effusion, we saw moderate pleural effusion, we saw massive effusion, and we have also seen the bilateral effusion. There are also corresponding findings. In minimal effusion, you will have only costophrenic angle blunting. In moderate effusion, both the costophrenic and the cardiophrenic angles are blunted, and also we have a dependent opacity with a meniscus-like contour. In massive effusion, you have a complete unilateral white route with contralateral shift of trachea and the mediastinum, and in bilateral effusion you will have these similar findings bilaterally. Let's see a couple of x-rays so that you become very familiar with pleural effusion. So this x-ray, you can very well note, compare this side with the right side. So here you have this both CP angles are obliterated, and then you have a dependent opacity with the lateral upward sloping. So this indicates pleural effusion. Again, so complete whiteout and shift of the trachea and mediastinum to the opposite side. Massive pleural effusion. So it's not a complete whiteout, but partially whiteout. We can see a little bit of lung up here, but the trachea is shifted to the opposite side. Mediastinum is also shifted to the opposite side. Again, it is a case of massive pleural effusion. Here you have fluid up here and a little bit fluid, little bit blunting here. So likely bilateral pleural effusion. So here we have a right-sided pleural effusion. So this costophrenic angle is blunted and cardiophrenic angle is also blunted, and then you have a diffuse haziness throughout the lung field, right? So this probably this X-ray is taken in the supine position, and you can also see that this haziness is more on this side and this lung margin is up here, you know, more I mean it is the lung is floating in fluid and you lie supine, so the fluid tends to go all the side and the lung is actually floating in that fluid. So you can see a distinct mark up here, right? So this is a central line. You can also see an endotracheal tube here. So patient is intubated and is lying in the bed, and this X-ray is a supine X-ray. So here you can see the bilateral effusion. So here the CP angle is blunted, and here also CP angle is blunted. So it is a case of bilateral pleural effusion. So conclusion, never miss a pleural effusion in a chest X-ray. Always look for the costophrenic angles and cardiophrenic angles in every X-ray that you see. Pleural effusion is one of the commonest finding, and it is very easy to identify. So always during your rounds, take a little bit of more interest in X-ray and see if any of these X-rays has pleural effusion. Thank you.